Sasa mimi ninaangalia Munyu, it's county, it's government, job security. And nimeanza tu because I was in my second year. But then kuna hii opportunity ingine imekuja, though ni ya 1 month. So I could go and then ikose kuingiana, halafu nitarudi wapi? When you challenge God, you know, he gives you, anakupatia ile kitu tu unaitisha. Ile siku nilikuwa booked kwa South Sudan ndio niende home for my rest. Our president had the lockdown on the day before I was supposed to travel. So I was locked out like for the entire year. Wakaona huyu anaweza enda hapa hivi. So I was evacuated. Aki nikasema the bwana ameaga, saa kutaenda aji. So baada ya siku kadhaa ndio nikasikia that it was a suicide. And that hit me so hard. Ni kama hata nilikuwa namjua. Wangu we are all mad. Degree tu ndio inavari. So unaweza kuwa maybe unapitia kitu that degree yako coping mechanism haikuruhusu ucope normally as it would be expected. So that is why people lose hope and they do things that would not be really wanted or warranted. When you're called to serve humanity, it's the fulfillment that comes with that. And I think that is what really matters to me. I think we need to embrace each other with outstretched arms, and we need to give people a haven, you know, a safety place, a retreat place, mahali wase wanafeel wako home.
Thank you so much for tuning in. You're just in time to catch us here on 3T TV, Thika's #1 online news channel, where we are telling the Thika story as it is. My name is Juliet Mudhoni, and today we are coming to you on location from Edgewood Country Place, which is located in Maboromoko, that is off Gatanga Road. It is a one-stop shop and a nice location where you can bring the family on Sunday for a family fun day. The corporates as well can come and use the grounds for team building, conferences. So be sure to check them out. As I told you, this year we are going to be having intellectually stimulating conversations, and mental health is one of the issues that we would like to be tackling every now and then, because it has become a very big hurdle for us as a nation since the onset of the pandemic. So on set today, I have a lady who is going to give us her journey, what she has been through, and what she is doing as a mental health champion. I hope that by the end of this segment, if you haven't subscribed, I'll have given you a good reason enough to. So let us dive right into it. How are you doing?
I'm okay. Thank you so much for having me.
Thank you for making time to come and have this conversation with us.
It's a pleasure.
I'd like you to introduce yourself. Tell us who you are and a brief background of your upbringing.
Okay.
Yes.
So thank you so much for having me. My name is Pauline Wairimu, born in Thika and raised here as well. I went at Kamenu Primary School for my lower primary, and then from there I went to Kahuhia Girls for my high school, and from there I didn't score what I had anticipated to score because I really wanted to become a doctor. Then I advanced to Uganda for my A-levels, where I majored in sciences, and again I missed by a point, so I couldn't really take medicine and become the doctor I had really envisioned to be. But coming back home, I went for my diploma in nursing, where I studied at KMTC Siaya 3.5 years, and later I went back home, came back home to Thika, and from there started working at Mount Sinai. I also went and worked at Kilimambogo, which is Immaculate Heart Mission Hospital. And from there, I had the urge of going back to school because I knew my minimum level was supposed to be a degree. So I enrolled and I went back to Kenyatta University, where I did my bachelor's in nursing and public health, which was really hectic because I had to balance through working, looking for the money and the school fees to still sustain myself, and as well to be able to serve people.
So, when we were having a conversation earlier,
Yes.
you mentioned about the struggle that you went through when you were at KU and you were also working.
Yes.
I'd like you to paint a picture. Where were you working, for starters?
By then, I started working, and I'm really honored, by African Muslim Agency Hospital, known as Hospital ya Msikiti, which is in Makongeni Phase 4. That is where they gave me the platform to at least be able to study and as well to be able to serve the people. And from there, I had to do nights every day.
So you were on duty at night?
Yes.
That is from 6 p.m., I suppose?
6 p.m. up to 8 o'clock in the morning.
There's one particular incident where, you know, you served quite a number of people in a night.
Yes.
Please give us that in a nutshell, how it was.
So nimeingia job, very tired, because lazima ungeenda internship at Thika level 5. That is where I was based. And after a lengthy day there, I have to come in because I have to sustain myself for my school fee. And when I'm receiving the reports, naambiwa kuna 8 women in labor, and I was alone. And all I can say and all I can remember is, aki niliambia tu God, afa hivi ni mimi na wewe, because 8 women, and you know vile inakuanga very critical, a delivery entails a lot and a lot of care and time. Na hapo ndio nikaanza my night, which was really terrifying. And the first mother akadeliver, and the second one, that night ilikuwa running up and down the entire night.
So you were doing everything on your own, from receiving the patient?
Yes. I had to be the receptionist. Ninaanza kwa reception. From there, mimi ndo nitaenda, I check the mother, and then from there I have to ensure the care from the very start to the very end. I also had to see the outpatients ambao walikuwa wana walk in, na wale ambao watazidiwa tulikuwa tunawaadmit. But it was just entirely me. That was a couple of years ago. But I'm very glad that right now it has grown. It was just me and the security person who would keep engaging me. When this one, when there's a patient, anakuja ananiambia, ananiita, niaji kuna mgonjwa huku hivi, so I take off, I run from huku nakimbia huku hivi. And I thank God because he stood with me. Na all the 8 women wakajifungua, the toys were okay, everything was just awesome. And then I just put a smile on my face when I was still walking around the corridors. Nikasikia mwathini, the Allahu Akbar, akita Waislamu waende wakasali, and I noticed hata food yenye nilikuwa nimebeba sijakula, but it's for a worthy cause. When you're called to serve humanity, it's the fulfillment that comes with that, and I think that is what really matters to me.
So you've always wanted to be in the medical field?
Oh yes, like every inch of me, I just knew from when I was very small. Yes, and to me it was that unaingiana na wasee, unaona venye wamekuja when they are really sick, unajani na wao, and then at the end of it all, mtu ana walk away. And the catch for me is normally when they turn back and they say, you know, God bless you. Umenisaidia sana, sitai kusahau, you know, and that is how we get blessings. And for me, I think nothing can really beat that.
Awesome. That is great. Service to humanity. Sasa uko pale ama bado uko shule, but you're still able to serve your people. For how long did you do that?
I served with AMA for 2.5 years, and I'm so grateful to them because they opened avenues for me. They pushed me to limits that sikuwa nadhani ningemake. Like when do una clerk patients, you're just from school, and inakufanya ukue, you know, very competent, and I owe them that, because even when I would go back to school, they would still receive me back. And after the scenario yenye nilikuwa na wamama 8 for that night, nilikuja nikaongezewa a clinician, and there was a cleaner, and from there took a grow. na saa hii ama is just the right place to be. It's grown and it's really honorable to be part of that commencement of that hospital na tukaifikisha mahali tulifikisha.
That is great. So after you graduated from school finally?
Oh yes, I did. That was in 2014.
So now you got your degree?
Yes, I've gotten my degree. And I was so happy because, I really wanted to have a limit for what I had always envisaged in my life. Na nikafurahia sana that the struggle was worth it. And amidst challenges za school fee ambayo, it doesn't really come easy. Ni kila mtu ana struggle, hatujakuwa na life iko easy, na life atinaenda nimetumia bursaries and I would say don't give up, try out these things ziko, na mimi nikafika mahali niko. And after that, God tu alikuwa naenda na mimi. Then there was an advert that came in for nurses for Kiambu County. And I applied. Now after that, go through the process of interview, and God knew so. I made it, and I got posted at Munyu, and that is where I was from 2014 up to 2016.
Now, you've come from Ama, where you were one doctor taking care of a lot of patients,
Yes, you had to
and
do
you're in
everything.
school.
Yes.
Now you're in Monyo.
Yes.
Where it's less busy. How was that for you?
I always love adrenaline. I think I was so used to the adrenaline. Yani unakimbia, uko hapo, uko kule, you're everywhere. And now nimeenda Munyu, where we are many of us, and it was pretty amazing for the first year because having had a lot of running up and down in the previous years when I was schooling and working, sasa nimefika Munyu, you are allocated in a particular segment or department, and for me I used to do all departments, so it was very slow for me, and I started feeling unproductive.
I can imagine.
Yes.
I can imagine. From running a whole hospital on your own to going for classes, and now hakuna kazi mob. So how long did you last in Munyu?
So I did 2 years in Munyu, and I remember nilikuwa kinaomba sana, naambia God, akibada, the way I've struggled kupata hii degree, akifanya tu kitu. And when you challenge God, he gives you, anakupatia ile kitu tu unaitisha.
Sure.
And so there was someone who found this advert about South Sudan. They wanted a lead nurse midwife, which was a big role, overseeing a reproductive health program, of which I had no experience about that. And it was kind of terrifying for me. Nilikuwa tu nasema, bana, I've asked you for something because I'm not feeling productive, and then boom, ndio umeniletea. But it's huge. But when God akikupatia kitu big inamaanisha umetosha mboga, like you're made for that, na ni lazima exalt through wewe, na especially when it comes from your heart. I think he just makes the path easy, and you get to heights that you can never really imagine.
I want to understand this very well.
Yes.
Monyo uko job ya county. That means job security, which we are all looking for.
Yes.
You're a graduate. I mean, struggle, umesoma na bursaries.
Yeah.
Sasa umepata job ya county.
Yeah.
Sasa tena una feel unproductive. Sasa Southern Sudan.
Yeah.
All the uncertainties. Ilikuwa ni contract ya how long unapewa Southern Sudan?
I remember that was the other terrifying decision that I had to make. But I thank my family, my dad, my brothers, my mom, my sister. Wamekuwaga tu na mimi, and I'm so grateful to them. So hii contract ilikuwa inafanya, yani I was at a crossroads. It was a 1-month contract. Sasa mimi ninaangalia Munyu, it's county, it's government, job security. And nimeanza tu because I was in my second year. But then kuna hii opportunity ingine imekuja, though ni ya 1 month. So I could go, and then ikose kuingiana, alafu nitarudi wapi. So there was really a back and forth kind of thing, and I felt, nitafanya aji nikiacha hii job security nikifikia hii ingine, and then 1 month pengine I don't make to be maybe their expectation, then what do I do? But nilikuwa nimesema nita take up the job nikipata after the interview, because kama nitapita interview it means I think I can do this, and nimetrainiwa, nimesoma, nimefika mahali niko, nimepata that vast experience, and now it was up to me now to make it. And I just told God, ujaniacha, so ni mimi na wewe tena tunaenda, hata kama ni 1 month, you know, ni God ana providingi, na ukimtrust, I mean you go places.
Sure.
So I went to South Sudan na nikaanza, and it was just giving my best in the way that I was best equipped from all the learning institutions zenye nimepitia. And by the second week I was so happy when the program manager aliniita kando after my work, akaniambia the hospital director amesema nipewe a full-term contract, and I was, oh my God,
By
that was
full-term
amazing.
contract, now it means how long?
Normally NGO wanakupea 1-year contract for starters, but as you progress on unapeangwa open-ended. So in the end, I'm so grateful that the 1 month, it's good to, you know, to dare and to dare God and to challenge God. Sababu ningesema bana wacha nikaya kwa hivi job security, singepata again experience kubwa yenye nilipata na exposure in South Sudan kama singe take your 1 month. Na the 1 month nikachapa job, it was hectic but it was so fulfilling. I mean, I don't think I've had a more fulfilling experience in terms of giving back to the society as I did in South Sudan.
So for how long were you now in South Sudan?
So I went in South Sudan in 2016. Nimeka. Actually, what hatujaamini, I left in 2021. 5 years.
5 years.
It's still from a 1 month contract. See what God can do.
I'm telling you, it's amazing. But from what I am getting from your story, there's something that you're still looking for in the medical field that hasn't clicked yet for you. So now Southern Sudan, 5 years.
Yes.
Please tell us the circumstances surrounding your coming back.
All right.
Yes.
Thank you so much. So, nimeka South Sudan, you train, you mentor, and you coach the nurses and the midwives, which was my title and my job description, which initially was a bit challenging because it's a new environment and you have to learn their system, and I'm also working in a new place. It's now an NGO and there are so many protocols revolving that. And in between all that, there are so many expectations. And we can't even begin to talk about the language because our say hawabongi Kiswahili, Kiingereza it's a few, so na uwezi kuwa unatranslatiwa kila siku. You can't, like, job ilikuwa mob, and you know we were in a referral hospital. It was in Upper Nile State and it was the only one there, so it entailed kukimbia. So
the adrenaline that you had been looking for from morning, now it's here.
God tu anakupatia ile kitu unamwambia kupatie, ndio tu anakupatia. And you know, at a point unafika unasema bana, I wanted this but sasa tena kwani ni aji. You know, you run, it's adrenaline. Baze, it would be so difficult at some points, but God ni great na ni gracious, but it was so fulfilling. So nikaendelea, nika have kulan Arabic. I can speak a few, I think kidogo miaka 5 si kidogo vile. Sure. So at least we can engage kwa nini, because that was a very big challenge, sababu uko na mgonjwa, unaongea na mgonjwa, unatranslatiwa, and then kenye unasema, you know, you have that thing of pengine sijapata kila kitu mgonjwa alikuwa anataka kusaidika nayo. So I had to have input and I had to learn the language. I did a bit of the local language, it's called Mabanese language, and some little of Uduk as well. But Arabic ndio ilikuwa inasikizwa sana, and I'm grateful that I had to learn that. And as well, you know, having people, unajua Kenya tulikuwa tumezoea sisi wote tuko registered and we are all in the same level na tunasaidiana, but now uko kuna challenges and the mere fact that umeenda uko na una raise our say na unawafunza Kenya umefunzwa, hey, that was like a big honor. I'm just so, I feel every day I say I'm blessed to just have that opportunity.
Awesome.
Yeah.
You were evacuated. Please tell us why you were evacuated.
So it's very, I don't, for the years tangu 2016 niende huko, sijai gonjeka, by the way. God has been gracious, sijai gonjeka. Then 2017 ikaenda, tukafika 2020. I remember when COVID kicked in, nilikuwa nimerudi that January from my leave, from my annual leave. Venye nimeenda, I was ready now for my rest. And ile siku nilikuwa booked kutoka Kenya niende kutoka South Sudan ndio niende home for my rest. Our president had the lockdown on the day before I was supposed to travel. So I was locked out like for the entire year. It is draining, it is exhausting because the ones who are supposed to travel back, wao walibaki home.
So there's shortage.
Well,
there was shortage
because
of manpower, so to speak.
Because for me, when I went there, you become the lead. So you oversee the program running.
Oh, yes.
So it is you who is overall in charge with the support of the hospital director, and you had medical coordinators, we had an administrator, but you're given your portion. So it was me, and then I had my staff who are nurses and who are midwives. Yes.
Okay.
And since they were also locked out, you know, you have to cover that gap.
So you worked. Burnout is real.
Yes, and you know, when they give you those 2 weeks, we would do 10 weeks, and then you break for 2 weeks, and then 10 like that. It's very essential. And when I would tell my friends that it's heaven, you know, unafika home and you feel, whoa, akini heaven. People don't understand. Yani umebit, solar, it goes to like 48, 50 degrees. It's insane. Alafu job. It's a referral. The only one uko.
KNH ya uko.
Exactly. Uzaenda break, don't forget that. Because I had to go back to my working station.
Yeah, there's a lockdown. Now you're in the country.
Exactly.
And you're a nurse and we need you. Your evacuation.
So I think nikapata burnout. I started having massive headaches. Mi sijai gonjeka, by the way, all the years, tangu 2016. Not even nothing. Nikaanza kufeel a lot of headache. Nikaangaliliwa lab. They saw scanty malaria. Nikapampiwa dawa. Haikufanya the first one. I was given tablets, nika throw up. So singefanya nini. Nikaekwa quinine. Hey, that one almost killed me. I did doses, it wasn't working out. I did IV, ini yenye unadungwa kwa mshipa. Na nilikuwa nakuwa tu worse and worse and worse. Wakichukua samples, waangalie, wanapata the malaria sasa imemultiply. Na mimi sijai gonjeka. So it was very awkward, but you know, God has a way of doing things na reasons za kufanya hizo vitu. After that, ndio ikabidi, wakaona, huyu anaweza enda hapa hivi. So I was evacuated. They had to seek medical help in another place because we were based in the field. So I had to be evacuated for further medical treatment. I was taken to Juba. Nikaenda. Nilikuwa nimekaa like 2 weeks nikipewa the medication. Nikaenda Juba, nikafanyiwa tests zote. So the malaria had resolved in 2 weeks. So haikuonekana. Everything else ikatoka ikiwa negative. After that, when I was given back my papers and kuongea na doki, the diagnosis ilikuwa fatigue and burnout. And from there, you know, I still felt unwell and I had to request to come back home for further, you know, advice in terms of medical treatment because everything was negative, but I was still unwell. So again, I was evacuated. At least our president alikuwa amefungua. And so I had an opportunity to come back home. Was taken to Aga Khan. Again, a run of tests. kila kitu umeexaminiwa courtesy of our NGO, and from there everything ikatoka negative, but from the history again ikatoka fatigue, burnout. But I thank God because during that time with the team wame rise up and they are doing well, nika feel I'm now feeling unproductive again, you know.
There's this thing that you're still looking for in the medical field, and now you're back in the country.
Yes, and I really had to think about myself, and you get the cue that this is my time to live. And I had to think, ni nini yote na nitafanya ndio bado nikuwe fulfilled na ni serve humanity.
Sure.
Na nika notice there was a time nilikuwa nimekam for my R&R, na hapo nikapata the death of Abel Mugenda,
Yes.
who is the husband to the Olive Mugenda.
Yes.
I am a KU alumni, and you know, when you have a woman empower you, encourage you, journey with you about Kenya amefanya, Kenya amepitia, you know, you look up to them.
Sure.
And after that, it was so saddening for me, and I really felt for aki nikasema wa the bwana ameaga, saa kutaenda aji. So baada ya siku kadhaa ndio nikasikia that it was a suicide, and that hit me so hard. Ni kama hata nilikuwa namjua, but I think it was from the connection from the wife, because ya venye ana, you know, ana influence wase in a positive way, and I couldn't imagine what was going on. And from there, I just thought to myself, what if there was something that could have been done at that time before he did that? Something like a helpline where you're anonymous, nobody really knows who you are. And I realized, I think I'd love to do that. Mental health has become a very big thing. There are so many vices zenye zinaendelea kwa mtaa. Wasee wengi wanajimada, wasee wengi wanamada wasee wengine. You know, they are just issues. Na especially yaki boy child bana. Sijui amekuwa neglected, ama there are too many high expectations about the boy child. And you know, I felt a burden for other people's burdens, sababu kwa nini kunaenda hivyo. So nikaanza kufikiria, I think tenya yangu ya kufanya hands-on nursing, I think itafika 2020. And I had to go back to school. Aki mimi nimehustle laki.
Masomo ni muhimu, by the way.
So I enrolled for my masters, na nikaanzia project management and planning, sababu nikakuwa in mind I'd want to do something big about mental health. And the better way niliona, how about nianze something like an NGO? Blows my mind every time I think about it. Unasikia tu umeogopa, unajiuliza, hey, kwani mimi ni nani? Kwani mimi nadhani mimi ni nani? But then God amewalk na mimi for so long, all through. And I believe he gave me that. He put it in my heart. And that is what now I want to pursue. Because we are really in need of awareness. We need to reduce the stigma, and we need to really build and address the issues pertaining mental health. Yes.
So Mugenda's case, totally, you know, it was the trigger.
Yeah. Yeah, for sure. Me, nilikuwa nadhani, you know, he was a whole professor. You know, those are the guys you look up to. Hata venye ninajaribu kusoma, you know? Yeah, alafu unaona wame-publish so many books, and they have done a really good job. But then I wondered, ni nini hiyo hatunge address? Ni nini hiyo haingeweza kuadresiwa? What is that pushed him, you know, to the verge of just saying, you know, I've had it, I can't do this anymore. And I'm thinking, I think kama yeye mwenye tuna look up to, inamaanisha there is that humane bit about sisi yenye haikuwa resolved. Na sasa tunaweza save Abel wengine, ma-professors wengine, ma-doctors wengine, unajua sababu tunapitia all these things. And I think changing one person, I think, is all we need. And mental health is really key. It's core. It's the umbrella za health zote. Because they say kila kitu inaanzanga kwa mind. Na kama mind yako haiko poa, then you're not settled. You'll not be productive. you'll not reach your goals. You'll always have something yenye inakuhold back, na ile kitu wase hawaelewi ni nini inaendelea na wewe. Kwa hivyo kuanzia kitu ya mental health I think ni muhimu sana, ili wase wajue ni nini hii inafanyaga Juliet a behave hivi. You know, unaweza kuwa ninakujudge nasema, hey, Juliet is a difficult one to work with. Na maybe it's even an unknown mental disorder or illness that is going on with you, yenye hata wewe mwenyewe haujui. But if you can start, everything is a step. Tuanzie kufunza wase, tuanzie activities zenye zita, you know, kufanya watu wa get diversion ya from the stresses and the strains, na zitakuwaga hapo, lakini I think we all need to take a step na tujaribu. Aki but mental health, aki wase, it's really important, na sana sana boy child. We really need to come through for boy child as well, because wanawake tumempoweriwa, we are doing okay. But pia let us not maybe neglect the boy child. Hawaongei sana, but if you can find means of, you know, penetrating and getting to see and reach their souls, I think tutenda a very far way.
Sure.
Yes.
And that is what we really need,
Yes.
moving forward.
Yeah.
You know, the reason why I asked your journey from your schooling up to here we are is because I want people to get that picture that there's something you've been looking for.
Yeah.
And you haven't quite found it until now. And that is being a mental health champion.
2021, I had to really think what I wanted. And there were just all signs from everywhere. And nikaona the best way nitafanya is register an NGO. It's a non-profit organization. Na God aka come through. Inaitwa the Outstretched Arms Haven. The words zina spread tu, zinaongelea tu whatever we are supposed to, you know, to do, because I think we need to embrace each other with outstretched arms, and we need to give people a haven, you know, a safety place, a retreat place, mahali wase wanafeel wako home. So hiyo ndio nilipata as the name. Like, I love to pray a lot. So mi tu nikaambia ki God, nionyeshe tu ile kitu ita relate na mental health. You know, sometimes you just need a hug from someone.
Sure.
Sometimes unahitaji tu mtu akuambie just a kind word. And I have been, you know, a recipient of someone saying or speaking a very kind word to me, yenye inafanya, you know, na feel tu poa sana. And so nika register and founded the non-profit organization ambayo ni hiyo, the Outstretched Arms Haven, na aim yetu ni kupatia wase information. We want to really reduce the stigma. Tunataka create awareness that it is okay to have a mental health disorder. And you know, tulifunzwa shule, we are all crazy or we are all mad. It's only the degree that varies. Yes. Hiyo degree tu yangu iko maybe chini, yako iko juu kiasi, unaona? Tunaambiwa we are all mad, degree tu ndio ina vary. So unaweza kuwa maybe unapitia kitu that degree yako coping mechanism haikuruhusu ucope normally as it would be expected. So that is why people lose hope and they do things that would not be really wanted or warranted for. So aim yetu ni create awareness, bridge your gap, and to openly address mental health issues. I have friends who suffer from bipolar disorders, and they are so willing to come and share. They have had a toll in their lives, na imekuwa a very difficult journey for them. But wanasema tunataka kubonga na watu tuwaambie tumepitia, tuko na hii, but haitu stop kuachieve. Unaona? So to just create that awareness, to address easy issues. And we shall also be having psychologists wenye wanakuja wanabonga about hii story, kama ni depression, aseme ni nini, what are the signs, tutamanage aje, and all that. So that sisi wote to move pamoja.
Sure.
Yes.
Sure. I think you have a YouTube channel.
Yes, I do.
You can, as we conclude, if there's anything else you'd like to say, then you can also give out your YouTube channel. And if there's a phone number that there's probably somebody who is watching and would like to partner with you, or would like to talk to you, you can also give them a phone number through which they can reach you.
right now?
Yes, please.
Okay. So our YouTube channel is the name of the organization, which is the Outstretched Arms Haven. Our phone number is 0743043054. So if you can be able to reach out to us, we shall come in handy in whatever matter we shall be having.
Thank you very much for your time, and from the look of things, I'm sure we will have very many more sittings to diversify this mental health
I
issue.
can't wait. I look forward to that.
And we wish you all the best.
Thank you so much. Thank you so much.
Ladies and gentlemen, that was Wairimu, who is now a mental health champion. You know, mental health is something that we cannot shy away from, and we hope that you have been able to pick a thing or two, and if you'd like to partner with her, kindly contact her. Remember, you have been watching 3T TV, Thika's #1 online news channel, where we are telling the Thika story as it is. Until next time, take care.